Is there a connection between mental health and your heart? Let's talk about it. Hello everyone, my name is Dr. Monisola Adanijo. I'm a consultant cardiologist, and you can also call me your friendly doctor with a heart. Now, people have been talking about the connection between mental and heart health. Is there really a connection? Is it a myth or is it a reality? Now, studies have shown that your mental health affects your heart, and at the same time, your heart affects your mental health. Take for example, for some reason, if you are always stressed, you have a lot of anxiety, and you have issues relaxing and calming down. When this happens, your body releases a lot of hormones. Now, what do these hormones do? These hormones increase your blood pressure. These hormones make you fat. And these hormones also make you have problems handling sugar. This predisposes you to diabetes, hypertension, and it also makes you gain weight. That is how stress can affect your heart. Now, how does your heart affect your mental health? Like I always tell people, 40% of Nigerians are hypertensive. And a common complication of hypertension is heart disease. Other complications include stroke and kidney disease. Now imagine a doctor telling you that you have heart disease and this disease is not curable and you have to live with it for the rest of your life. Or even worse, they tell you that because of this heart disease, you have only a 50% chance of being alive in the next 5 years. That will definitely affect your mental health. Many people feel depressed, some feel anxious, and all these things contribute to a poor mental state in many heart disease patients. So the thing is, how do we cope? How do we cope with mental stress when we have heart disease? First of all, if you've been diagnosed with heart disease, you need to be around people who love you. You need a strong sense of community, and these people will encourage you and help you feel better. You need to seek for information, not information from forwarded WhatsApp messages or information from old wives' tales. You need to seek proper information from people who know what they're doing, specialists either online or physically, who can guide you on your heart health journey path. Now, this is not the time to start drowning your sorrows in alcohol or drowning your sorrows in drugs, okay? Because this will only make your prognosis worse, and it will only make the heart disease progress much faster. Now, many of us are stressed. Many of us live in urban cities. There are so many reasons why we're stressed. We're stressed because of money, we're stressed because of our families, we're stressed because of our jobs. And this heightened stress state, like I had said earlier, can lead you to having heart disease. So what do you do? How do we control stress? First of all, we need to learn to take time off to relax. The average Nigerian thinks taking time off to relax means going on holiday and shopping all day. That's not how to relax. Relaxing means unplugging, leaving behind most of the stresses of urban life and finding a way to decompress and distress. Okay? How else do you reduce stress? You need to get your adequate hours of sleep. The average adult needs at least 6 hours of sleep every night. That is also important to reduce stress. How else do we reduce stress? We need to learn to delegate. We need to learn to ask for help, ask people to help us to do some things we cannot do. And most of all, it doesn't pay to overthink things. If something is not within your reach, it's not the time for you to stress and worry, because stress and worry and anxiety never solves anything. I hope these tips were useful. For more health tips, please follow me on Instagram at Moni_Adanijo, on Facebook, Diary of a Lagos Cardiologist, and on LinkedIn, Monisola Adanijo. Till we meet again, stay safe, stay healthy.